Welcome to the Illuminating Primary Care podcast.
Hello, and welcome to Menlo Park's Illuminating Primary Care podcast. I'm David, and today I'm joined by Dr. Nabeel Arshad, who is a GP at the Brooke Surgery in Hyde. It's also one of Google's highest rated GP surgeries, and I thought this would be a really good opportunity to find out a bit about some of the work you've been doing at your practice. Thanks for joining me.
No, thanks for having me on. I'm excited to have this conversation with you, David. And it's nice to kind of have the opportunity to talk about the things that we've done.
Fantastic. A really good starting point would just be understanding a little bit about how you've managed to engage patients in reviewing. I think it's typically quite hard, to get people to post positive interactions in any sector, especially healthcare. So it'd be great to just get a bit of an understanding about what you've done to do that so far.
Good question. I guess if I look at, it's useful if I describe how our surgery ran previously and what we did to change things, to give context to the reviews. So when I joined as a partner approximately 3.5-4 years ago here at the Brooke Surgery, one of the things I noticed was that generally patient morale wasn't great. They find it difficult to get appointments. They have to phone up in the morning, phone multiple times to get through. And sometimes, you get a multitude of patients that end up on your on-call lists. The reception team try their best to accommodate as many patients as they can, but equally they know the clinical staff that are receiving the patients can find it quite difficult. And as the clinical members of staff, as one of the GPs, on on-call days, we can have lots of extra patients. And some of them are perhaps not appropriate to be an urgent patient. They could have been a simple phone call or a quick message that could have been dealt with, but instead they're sat in front of me. And then equally, their patients going to A&E that shouldn't be, and they're waiting hours and hours, and it overwhelms A&E. And I looked at our Google reviews during this time frame. We actually we had a Google business profile, but we hadn't taken it over. So, anyone could have taken it over, which is quite an alarming thing. I only came through it. There's a prominent GP called Dr. Gandalf, and he made people aware that this could happen. So this is the moment where I thought, okay, we'll take this over. Yeah. And our rating was quite low. I think it was something like 2.6 after about 150 reviews. I asked myself, if I was accessing a service, if it was 2.6, would I want to access that service? Would I, if it was a fee-paying service, would I pay my fee? If it was a free service, would I really want to be a part of that? And the answer is clearly no. So as a partnership team, there's three of us. There's Dr. Farouk and Dr. Kopanu and myself. And we have a really strong management team. And we sat down and we thought, look, okay, we don't think things are working well. And I'm sure a lot of GPs share the same sentiment. And we thought, okay, we've got these walls surrounding us that we have to kind of ensure we fulfill basic things like a contract, GP contract. But how can we make it work so that it benefits the patient, but also benefit the clinical team? So we started from the scratch. We started all right from the beginning. We looked at all the pain points that the patient have. Yeah. This is through the PPG, sending out questionnaires, and just starting with each point one by one and doing our best to accommodate that as a part of the whole system.
Yeah.
So what we have now is a appointment system that's open 365 days a year, 24/7. Mm-hmm. So you just can ask for an appointment anytime. It sounds scary. I can imagine some clinicians thinking, "Oh my God, you're probably going to be overwhelmed."
Unlimited access, yeah.
Yeah, just drowning in requests. And at the outset, it might feel like that. But what we thought was, patients often worry more when they can't get through and they can't have communication with a clinician. What if we had a system that allowed them to communicate with us and we can communicate with them quickly? Even if the communication was, hey, we've got your request, it's a bit late in the day, we'll message you later. So I guess there's a lot to be said, but to summarize, this appointment system empowered the patient to feel in control of their healthcare. They can ask for an appointment when they wanted. And though we're open 24/7, 7 days a week, bank holidays included, weekends included, our average time for an appointment completion from when it goes onto the system is only 5 hours. Yeah. That's including the weekend. So it shows you how fast we're working in the week, that the fact that weekend requests don't actually skew that data. Yeah. The patients through that have become very grateful. Mm-hmm. And, before, the same patients who were putting in negative reviews about how it was so hard to access us and, how difficult it was to get an appointment and the measures they had to take in place, queuing up in the morning in the cold, phoning 150 times. I remember a patient showing me the phone. I phoned 150 times to get this appointment today.
Yeah.
Unacceptable in my eyes. Like, how can we create a service that does that? So, those same patients were then reviewing us saying, wow, look at the change. We've had an input in this change. The surgery has listened. And they're really grateful. They tell their friends and family. And the key thing is, because they value the service, they've experienced the before and the after. Because they value the service, they're more willing to, spend a few moments to give a review. That's why, we are now Google's highest rated GP surgery.
Yeah, and in terms of that kind of growth and positive reviews, is that all been quite organic in terms of, has it been kind of organic traffic towards leaving positive reviews? Or, what have you done to kind of actively promote people, going out of their way to do that? Have you used social media to do it? Have you kind of directed people towards it during consultations? How have you done it? What's the trick?
So I guess most of it comes from the value that the patients feel that they're getting from our service.
Yeah.
So, and again, they compare before and after. Another thing is that we're very, very active on social media. So we use social media to engage our patients in a multitude of ways. And that does funnel patients back to sometimes giving us more reviews, like on things like Facebook and Google. So I'll give you an example. So during COVID, we noticed that we were getting a lot of requests with so much uncertainty from patients. What's happening with the COVID? When is my cohort going to get the vaccine? What happens if I'm positive for the COVID positive? What happens? Can I still go to work? Can I still do this?
Yeah.
Lots of misinformation. They felt like the government updates, though they were regular, they weren't specific to the patient cohort that we have.
They weren't digestible, were they?
Yeah. It's like, it's just gobbledygook. It's almost like when we're taught, if you're giving information to someone, give it in lay terms, give it in terms that's digestible. As soon as you start adding a level of complexity, you're going to, if the average reading age of the UK, I think, when I last checked, was 9, you excluded half the population. So we use social media to combat that. So we created regular videos preemptively to inform patients. And that had a massive impact on the patient kind of trusting us. They knew that they're going to get trusted information from a healthcare provider that's their own. It actually went viral locally. So even in the local area, some of the videos had tens of thousands of views. They were really benefiting it from as a cohort because it was relevant to this area. Yeah. Obviously, each PCN, each area was delivering the vaccine schedule in slightly different ways, and I was able to give them the specifics. And we extended that to things like common requests. We measure everything that comes through. So if we have, during the summer, spring, summer, we had a peak of hay fever requests. We said, okay, lots of people are asking for requests, but actually, if we gave them some information, they might have actually realized that they could do some things themselves. And secondly, they could go to the chemist for some things over the counter. And that's exactly what we did. We created a video, sent it out to all our patients, and the number of hay fever requests went down, but they felt empowered. Again, that leads into the patient's value or the perceived value they get from our service and plus the reviews.
Fantastic. And I guess it kind of ties me on to my next question about not in terms of engaging patients, but I guess clinically, what are you doing differently to other practices? How are you kind of establishing such a positive experience for them? Because it must differ in some ways to maybe what a lot of surgeries are doing, because it's had such a profound impact in terms of patient response to you.
Yeah, I mean, I can't really account for what other surgeries are doing. What I can compare it to is what we used to do before.
Yeah.
So what we do is to make this system work, we need to invest in all components of the system. So because of the system we set up, our surgery grows. Lots of patients are attracted to our service. Word of mouth, friends and family join us, and we grow. And then with the additional stream of patients, that additional income, we reinvest it back into the whole process. So things like, investing in the best kind of technology, the best softwares, consultation systems, phone lines, and anything that we can do to optimize general practice. But more importantly, our staff. So we'll make sure that we train our staff, give them regular training schedules and things that allow them to grow, so that they feel valued as staff members too. Yeah. Sometimes when you have a system that's open the way we are, it creates slightly different nuances that you need to deal with. But if staff feel empowered and feel trained to deal with these variety of aspects, then they give more as well. They give their all. So not only are the patients benefiting, the system's benefiting, so are our staff as well.
Fantastic. And I guess, this model you've talked about where there's clearly an improvement in terms of access. Has it had a knock-on effect in terms of, workload? Are there any trade-offs in terms of kind of the level of work that GPs, clinicians, reception are dealing with?
A very good question. I would say when we first started the process, your patients would often lump a lot of problems together and come all at once, and it was it can be quite challenging to deal with that. Mm-hmm. What we did, however, was we measured our demand month by month, year by year, variations over winter periods, summer periods, and we staffed up accordingly. So our staff is not based on arbitrary numbers or arbitrary kind of formulas. We know exactly to a rough, to 5 to 10% accuracy, how much requests we're going to get when, post-bound quality, how much requests we're going to get. So we staff up in advance of that. So even if there is an increase in workload, we have measured that, and so we deal with that. If that means hiring an extra member of staff, if that means having locums certain days a week to help accommodate for that. Sometimes you can have difficult moments. So if a couple of weeks ago, as I mentioned to you, that we had quite a few staff members off. So I think on one given day we had up to, including annual leave and sick leave, about 10 clinical staff members off.
Right.
But our system was still open, so we weren't close to requests. We don't close to requests. So those times are even more challenging. And in times like that, the trade-off, I guess, is we kind of pause or postpone non-urgent work.
Yeah.
Meetings or any strategy planning that we have in the background. We pause it, push it to the side. Those things can wait. We need to deal with the patient. So there are trade-offs on a week by week, and those things are hard to predict because you can't predict when people are going to be sick. And I guess that's just the human nature of dealing with bigger teams. But yeah, I mean, I would like to say that despite that, and despite having that system, we've adapted very well because of how dynamic the team is.
Mm-hmm. Fantastic. And I guess you touched on this earlier about the emergency services and potentially the impact you've had taking work away from there, because it does sound like you guys have been incredibly busy in a positive way. What sort of impact do you think that has had on, like, say, the wider emergency services?
So to answer that, if you remember what I said before, in the old system where patients who couldn't get through, they just ended up falling into A&E.
Yeah.
Because now that even, let's say, they realize their problem because they're at work or something's happened after 5 or 6 o'clock when we're just about closing, they know that perhaps they won't necessarily get consultation, put the request in. But because we've built a trust with our patients, knowing that we will get back to them the next day, because again, we've measured the demand and the capacity and we do accordingly, they don't feel like they need to go to A&E unless it's an emergency. They feel like they don't have to go to A&E for their throat infection or their chest infection or a query that they have, because the time waiting in A&E, which could be 10, 12 hours potentially, they would rather just wait till the next day with us. So actually the data from the ICB, they did give us the data, and it showed that despite our list size growing by 70% at that time, the number of A&E admissions from us only went up marginally. Mm-hmm. So in real terms, that's a massive decrease in number of referrals that we were sending to A&E for our list size, and we were relatively moderate sized surgery. And a similar impact was seen on 111 calls. Patients don't feel the need to phone 111 because they know that they can phone a trusted clinician a few hours later. They just have to wait till the next morning. They don't even have to phone. They put the request in and they wait for us to phone them back. And we'll triage it, prioritize it, phone them back. So in terms of the emergency services, we've had a huge impact on how many patients of ours actually access that now. So locally, it's a very beneficial thing for the hospital, our system. Yeah,
I mean, it sounds fantastic. And I guess, looking at, things a little bit closer to home, do you think that change in perception from patients and kind of that improved, opinion of your practice, do you think that's had a knock-on effect on job satisfaction for your clinicians? Has it changed how they behave towards doctors and nurses and everyone else?
It's a very good point to raise. I remember one of our staff members that joined us not too long ago, and I was sitting down with her and I said, how are your first few weeks going? Any points for us to develop and things that you would, that you have any advice for? And one thing she commented on was, one thing she noted off the get-go was that patients when she was phoning patients, they were a lot more receptive to listening to her advice and more trusting of her plan. And it didn't feel like she was having a battle with the patient. And she didn't really know that that was a thing, because previously in her other surgery, patients struggled to get appointments. They would have to fight and they'd be waiting. So, they might have had ear pain, ear infection getting worse, day 5, day 6, day 7, went to a knee, took too long, came home. So they're really charged and upset and angry. And though it's not necessarily directed directly at the clinician, it's palpated throughout the consultation. When you say, look, I'll give you X, Y, and Z, why don't you come back in a few weeks' time? The patient might say, well, I barely got in this time. How am I going to get in a few weeks' time? Can you make me the appointment? How confident am I that you'll phone me back? What she was saying is that wasn't happening here. The patient would listen, say, okay, thank you. Yep, we'll get back in touch in 2 weeks. So the art of the consultation just seemed that much easier. Patients were a lot more receptive. And because it was working that way, she felt like she could go the extra mile with patients as well, because it wasn't such, each consultation wasn't such hard work. You could try and perform to the best of your abilities without having that friction. So it has had a big impact on how they perceive us. Similarly to when we share posts on social media, we get lots of engagement. So if we have, won an award, we won an award recently as Tameside's primary care #1 primary care service. Tameside, and patients would respond to that, and they would agree with that, and that's very rewarding for us, because it shows that the work that we're doing, patients value it too. It has had an impact, a big impact.
Fantastic. And I guess a big part of that is just people, I guess you're not, as a clinician, I imagine you're not on the back foot straight away dealing with patients where there's a wall up.
Exactly.
Which is fantastic. And I guess, has that helped in terms of retention at the practice? So has that kind of improved reception by patients, led to, an improvement? Has there been any kind of, tangible improvement in terms of things like retention or kind of recruitment? Yeah.
So the way we work, because of how our system is, it works very differently to what clinicians are normally used to. So we don't have set appointments for patients unless they specifically ask. So, and also we do a triaging first. So you'd call the patient and then decide, am I going to call them in face to face? Can I deal with it with a phone? Do I need some images? And what it does, it gives a lot of our staff, particularly clinicians, a lot of autonomy. So they can kind of control their day. I'll have some face-to-face in the morning. I might have a break here. I need to do a couple of things, and I'll finish off with a phone call. And because it gives them a big layer of autonomy, the patients are happier, and they know that it's a well-esteemed practice. All those factors come together, and clinicians typically like being here, and they typically stay. There are clinicians that come and go, things like trainees, which we don't really have control over. They're on the pathway. But the staff that we've hired, they tend to be happy and they want to stay. And the reputation that we've got amongst staff is that lots of staff want to join us because they've word of mouth through staff. It's a really good environment. They look after us. And like I said, almost everyone has some sort of training pathway where they can develop and grow. We don't put limits on people. We don't put limits on our system. We don't put limits on people. We say you can grow as far as you can grow. So all of that has kind of created an environment where clinicians feel valued within the system.
Fantastic. And I guess, this is a bit of an off-the-cuff question for me, but have you enjoyed actively promoting on the social media side of things? Because you seem natural at it, and it's not something you see a lot of GPs, doctors, clinicians, people in healthcare doing that often. But obviously, I came across you through social media, so that was why I reached out to you to kind of get involved in the podcast. But do you think that's maybe something that practices aren't using enough? And I guess, is this something that you kind of always thought you might go into, or has it just been a response to like you say, initially negative feedback and really wanting to overhaul the system? Where's that come from, aside from wanting to improve things?
Good. Yeah, it's a very good question, actually. I guess prior to being in a partnership, I used to do a lot of teaching with the GP trainees. I still do a bit now.
Yeah.
And I noticed that, often I would give similar advice to a multitude of people. And I realized that the amount of people I could benefit would depend on how much time I had, how much time I could spend with people. But then I thought, okay, if I'm giving people similar advice, what if I made videos that I could share with the trainees and then I benefit a whole cohort of them, those who watch it? I spend, a few moments making that video, but a bigger cohort benefits. So I did have some kind of experience with that. And then when I came to general practice, I think the practice manager at the time, she had seen some of these videos and she thought, wouldn't it be great if you did that for some of our patients?
You got roped into
really
it.
benefit. And I was like, well, okay, it wasn't really something that I was thinking of because like you said, it's not really done in general practice. I guess in the world of social media, you see more influencers, but they're not typically tied to a surgery. They're more independent social influencers. So we started that during the COVID and we saw the benefit our patients were getting. I think sometimes people have a fear as well that, if you look up your reviews generally, if they're not great, if you start going on social media, the patients will then use that as an outlet to complain. And that can be quite a frightening thing if you don't quite have the right resources and manpower to deal with
consistency as well, though, isn't it? Because I have seen that happen. You get practices where, they've had an event and it's led to, maybe a range of negative feedback from patients. They try to, I guess, reinvent themselves and, really push on social media. And then, unfortunately, they kind of don't keep up the momentum with it, which I think is a shame because, like I say, it's such a useful tool. And does that subside? So I guess from your experience, that kind of initial negative reaction, does that subside once patients start to see real differences in the service?
I think it depends on how you interact with that. So it's how you respond to feedback. So at the Brooke Surgery, despite the success that we've had, we still get patients messaging us saying, "Oh, hey, look, my prescription wasn't signed in the 48-hour window like you said you would, or this particular, I put a request and I didn't get quite seen as in the time frame that you said." You get these moments. And then I think the key thing is that not to dismiss it, find out what's happened there. What can you do? What has gone wrong? Is there anything procedurally that you can get right? Are there any changes you need to make? And because we follow that process with most of the feedback that we get, the patients are experiencing the benefits of their input. So in that respect, yes, it does subside because when they do have a suggestion to make, we take it on board and we try to put it in place and we communicate with them, this is what we've done. And then they value that because I think everyone is aware that, when you're dealing with something like healthcare and you're dealing with so many patients, so many people, things don't always go completely right. But if you're transparent, open, and you're willing to work at it, then you gain their trust. And I think I keep using that word trust, but it's so powerful with a patient. When you build that level of trust with the patient, you can have a more meaningful connection with them. They're less likely to overburden your resources and trust you when you say, look, hey, this is what we'll do for you. This is how much time you need. And they're willing to respect those kind of time frames.
And do you think, again, that this is linking more with kind of the social media side of things and rather than kind of overhauling the clinical systems, because that probably has really good universal, applications in a wide variety of practices. But do you think that the social media side of things is something more practices could do better, even if they're in, semi-rural, more affluent, elderly areas? Do you think there's are they missing a trick, do you think?
Definitely. I think social media has so much power. A big cohort of your patients won't be on social media, and another cohort of patients will be on social media but won't be following your page. But those who are, the information that you can get across to them with the least amount of time invested for the maximum benefit, that process is, for me, extremely valuable. You want to communicate a change in the surgery, you want to get some feedback, you want to celebrate something in the surgery. You can have such a big impact with social media. So, if their practice is listening to this and they're hearing this, I would implore them to definitely think about a strategy, what they would like to do with social media. It has so many benefits.
Fantastic. I guess that sort of ties me into my last question, really. And are there any tips you would give surgeries who are maybe in a more kind of embryonic phase of this, so they're starting maybe to pay more attention to it and kind of have a look at what they can do? Are there any kind of maybe sort of succinct tips you could offer that would help them?
Yeah, I think it's important to, when you are starting out, look at the feedback that you already had. So patients often are quite good at leaving feedback, whether it be positive or even negative, and see what kind of themes are there. If you're able to kind of look at those and anticipate that those themes are likely to crop up, but if you're able to either address them, and if you're not able to address them, communicate what you can and can't do about them. I think that puts you in good stead. And you can start off simple things like you might have a breast cancer awareness day, awareness month, and you might want to promote a post of that and see how people engage. So you can use it as an experiment as well. Go with simple things that are informative, beneficial, and see how patients respond, and then allow those moments and those kind of posts to develop your confidence and also help develop your strategy of what you would like to do. It is important to have a strategy. And, I think people who haven't had experience with social media prior to being in their job roles, they might find it difficult. So using organization to help with that can help. There's a few around, Primary Care Comms, Cara from Primary Care, she's fantastic. She gives practitioners lots of advice and support. And I've heard of other organizations that do some similar things, like Redmore and a few others. So this is on the up. And I think people who are utilizing it see the benefit. And because they're seeing the benefit, they want to try and push this out more for more practice. Yeah. And I agree. I think it would be a great thing if more people came on board.
Fantastic. But yeah, I think that's all I've got time for now. So thanks so much for contributing. Really appreciate you taking time out your really busy day to fit me in. So yeah, we'll leave it there. But I think you've kind of really offered a good insight into what you've done, the changes you've made. But I think the sort of key takeaway for me is really the impact of social media, and maybe practices aren't using it as well as they could, or maybe don't know how to yet. But thanks again for talking us through it all.
No, you're welcome. And I guess one thing I wanted to mention was we are starting a new social media project. Actually, we have invested a lot of time and trained a few of our staff to create a set of videos to benefit our patients. So something to look out for. We're going to be really doubling down on the benefit that we give our patients.
Fantastic. Well, yeah, thanks very much.